Disability Administration Self-Directed Services. This is the Self-Direction Act. Delegates Lewis Young.
Thank you very much, Madam Chair.
My pleasure.
In a more ideal world, this bill probably wouldn't be necessary because in 2005, Maryland created the New Directions Waiver, an Independence Plus program that allowed individuals with developmental disabilities to direct their own lives and care, allocate their funding, and hire their own employees. Unfortunately, since 2013, the aspects of this program have been systematically walked back, and subsequent and significant changes limiting self-directed care have been put in place. And much of that is documented by very extensive audits. So what this bill does is three things. It simply restores the original intent of the 2005 program by again empowering participants to self-direct their own care. And it provides a definition of self-directed care, which will be codified into law, and it will ensure individuals living with developmental disabilities the ability to direct their own lives. Secondly, it establishes support brokers to help individuals living with developmental disabilities to self-direct their care. And finally, it creates an advisory council to ensure that any issues with self-directed care are resolved. Madam Chair, I'd like to give the remainder of my time to Alicia Wopat, and be followed by Carol, Ginger, Sunny, and Patty.
Thank you, Delegate. So, Ms. Alicia Wolpak, will you be so kind to testify, please?
Thank you. I am the president of Self-Directed Advocacy Network, SDAN, an all-volunteer advocacy organization, and I'm the proud mother of a son with autism who is in his 5th year of self-direction. I hope you all have had an opportunity to view our video and read some of the stories from SDAN members who are asking for your support of this bill. It's really important for you to know that the Federal Centers for Medicaid and Medicare Services, CMS, defines self-directed services as allowing participants to have responsibility for managing all aspects of service delivery in a person-centered planning process. Self-direction promotes personal choice and control over the delivery of the waiver and state plan services, including who provides the services and how they are provided. Participants are afforded the decision-making authority to recruit, hire, train, and supervise the individuals who furnish their services. The CMS allows states wide latitude in how they implement these programs, and Maryland's DDA is moving away from allowing participants to control how and by whom they receive supports. Self-direction has been severely curtailed here in the last 6 years. Nothing in this bill jeopardizes federal dollars. Our bill seeks a restoration of previous levels of choice and control, where incidentally, all federal matching funds were available, contrary to the MDH contention. An option that was once individualized, person-centered, and efficient is morphed into one that is ever more standardized, state-centered, and costly. Policy and procedure changes have included some of the following: elimination of overnight supports as a self-directed option. What is now offered is an agency where you lose control over who is hired to provide supports in your home. Elimination of individualized transportation arrangements so people have funding to get to their community activities. Severe restrictions on funding for activities and therapies, such as music, art, and writing. Future elimination of choice and control and competition for essential fiscal management services when choice increases quality and decreases cost. Restrictions on who's even eligible to self-direct. Restrictions on the participant's team choice to hire family members when it's in the participant's best interest and their preference. Restrictions on the amount of the scope of the assistance of the support broker, the only real professional on the team with a fiduciary duty strictly to the person. Support broker roles have been shifted to overburdened and undertrained coordinators of community service or CCSs. Creation of dysfunctional methodologies and procedures that are hurting participants by causing confusion and delays. Contrary to MDH's opposition letter, the 4% COLA that you all voted to give all DDA participants has not been given to most of the self-directing participants for FY21, 6 months after the fact. It is certainly not duplicative. At a minimum, 59% of our members do not have it. The mere 14 who have received the COLA expressed that they really had to fight for it, citing repeated requests and conversations with their CCS and DDA directly. In conclusion, and most importantly, none of these restrictions and eliminations are due to the CMS rules. They're Maryland's DDA choices, and none of the aspects of HB 318 put the federal money in jeopardy. I also want you to know that we haven't taken this lightly. SDAN spent thousands of hours of time, attended every meeting and work group that DDA's invited us to, every time. We've responded in writing with public and private comments, feedback, and recommendations, written emails of concern and numbers too high to count for 4 years. SDAN's met with Secretary Beatty, Deputy Secretary Simons quarterly, and now monthly, and will continue to do so. We've joined 7 other disability advocacy groups in regular meetings with then Secretary of Maryland Department of Health, Robert Neal, to try to right these wrongs. And although mandated to seek input as the MDH letter does state, DDA's heard much from us, but they rarely listened. So here we are with a less flexible, less person-centered program that has left its participants with less choice, less control, and some in jeopardy of their health and safety. That's why, along with us, other advocacy groups are supporting this bill. ARC of Maryland, DD Council, Disability Rights Maryland, just to name a few. And we're asking for your support too. Next, I believe you'll be hearing from Carol Custer, SDAN board member. Thank you very much.
Thank you for your testimony today. Ms. Carol Custer.
Hello, I'm an SDAN board member and volunteer and a professional support broker for over 20 people. I have always fought for their best interests, but I have never made a decision for them, nor have I ever authorized my own payment. With his and his family's permission, I will tell you about Desi. His story illustrates both the human and fiscal costs of DDA's version of self-direction. Desi was a preemie with multiple disabilities. In 2005, he was one of the first in Maryland to get into self-direction. It gave him choice and control of his life. Desi's parents, now in their 70s, have always freely given many of the 24-hour supports he needs to stay safely at home. Aware of their own mortality, they sought to ensure continuity of the routine that has given Desi security, well-being, and joy. They worked hard, saved their money, and provided him with a small home. They retained dedicated staff who have worked for him for years and years and years. In January 2020, Desi sought more support so he could move into his home. He needed just $24,000 more per year. Despite demonstrated need, DDA denied his request, citing cost effectiveness and new restrictions on personal and overnight supports. DDA's alternative, all but 40 hours a week of Desi's staff must become an agency employer at a lower pay rate, putting him at risk for losing these consistent, dependent employees. The actual price tag of this cost-effective supportive living option, at least $44,000 more than Desi's initial request. The actual cost to Desi, little say in who helps him go bowling, fix dinner, or use the bathroom. Little say in who is with him when he wakes at night, thinks it is day, and tries to leave the house. Little say in the self-directed life he chose for himself in 2025. Thank you for your time.
Thank you for your testimony. Next, we have Ms. Ginger Houston.
Yep. Hi, my name is Dr. Genevieve Houston Ludlam. I am a volunteer board member of the Self-Directed Advocacy Network. I'm also the mother of Carmen, my charming adult daughter with Down syndrome who self-directs her DDA Medicaid waiver services. I'm here to present you with the data supporting SDAN's concerns. You have heard testimony stating that self-directed services, along with being a more person-centered way of delivering services, is also more cost-effective. We received anonymized budget data from the DDA through Freedom of Information in December of 2020, making this a very current snapshot of currently active Medicaid waiver service budgets. The average budget for people self-directing their Medicaid waiver services is about $65,000, compared to an average budget of about $89,000 for people receiving traditional provider-managed services. On average, the self-directed model delivers a 27% cost savings to the state of Maryland while providing tailored services to the individuals out there living their best lives the way they want to live it. Win-win. Finally, if you have heard about problems we are having with the DDA, including timeliness of budgets, lack of communication, and non-responsiveness. SDAN conducted a survey of their membership on these issues in December of 2020. 60% of our survey respondents said they were having issues with plan approval or updates. Right now, 24% of self-directed plans have not yet been approved by the DDA. In the comments, most respondents cited delays and lack of responsiveness from DDA as their main issues. Let me conclude with briefly sharing my own personal experience with these issues. My daughter Carmen transitioned from school-based services in July of 2019. For 6 months, she was left without her waiver services because DDA did not get her budget approved. In fact, the only reason it did get approved was that I contacted the governor's office and the Maryland Department of Health. The next July, her new budget was supposed to begin. It was not approved until September, and only after I threatened to go to the governor's office again. Thank you. Now you'll hear from Sunny Sefarati, one of our SDAN board members and a self-directed participant.
Ms. Sefarati.
Good afternoon. Thank you, Madam Chair. I am a self-directed services board member. I'm an SDAN board member, and I am also the co-founder of the Musical Artist. I just want to ask, I am completely blind. I'm just wondering if everybody can see me. My video is on, like you requested, Madam Chair.
We can see you clearly and we can hear you beautifully. Thank you for being here. You can proceed.
Yes, ma'am. So I am an SDAN board member and I am co-founder of the nonprofit organization called the Musical Artist. Upon graduating from the Maryland School for the Blind in 2007, I was placed in a sheltered workshop where I remained for 8 years. I started self-direction in 2016. My support broker, CJ Shiloh, who is also the co-founder with me on the Musical Artist, helped me get out of the sheltered workshop. Not only do I serve on the Musical Artist Board, but I also serve on the Maryland Developmental Disabilities Council and the Self-Direction Advocacy Network Board. If CJ had not helped me get out of the sheltered workshop and start serving on these organizations, I would still be there. DDA definitely needs to be accountable, and I believe that the advisory council, if this bill is passed, would make DDA be more accountable for some of the miscommunication and some of the issues that we've had. Self-direction has definitely had a positive impact. And being in the sheltered workshop for 8 years was pretty bad because I had to work under the mercy of someone else rather than take charge of my own services. So self-direction has really changed my life. And I just want to give credit to CJ, who is my support broker. And I just want to say that she has done a really good job helping me find this program, and it's working. Thank you for your time, Madam Chair.
My pleasure. Your timing was wonderful. Next, we have Ms. Saylor. Is Ms. Patty Saylor?
Yes, hi. Thank you, Madam Chair and committee members. My name is Patty Saylor. I'm an RN, and I've been working for people in self-directed services since its inception 15 years ago. I've worked for almost 100 different individuals and their families over that time period. I've witnessed the impact of the changes that DDA has made over the last 5 to 6 years. I chose to begin volunteering with the Self-Direction Advocacy Network to represent the needs of my customers, many of whom are consumed with the demands of their lives and rely on advocates to convey their concerns on their behalf. I was going to illustrate to you the negative impact changes that have happened to people, but I think you've heard that. I instead want to tell you about the human toll that I witness. In the course of my job, I speak at length with my customers and their families. We laugh and we cry, and I tell them that it's going to be okay when they're no longer here, that we will protect the system so that it will be here when they are not. On a daily basis, I see firsthand the pressure they're under. Families are our best natural resource. The state should value and protect them as much as we can. They continue to take the lion's share of financial and physical support of their loved one. Their love of their adult children or their sibling should not be exploited by the government. While they are grateful for any and all supports they get from the state, and grateful even more so for the flexibility during the state of emergency, they are exhausted and frustrated and angry and fearful. They are fiercely protecting themselves and their individuals from the virus. They're taking on the role of direct support so staff do not come in and out of their home. They're under economic and work pressures. They have very little sleep and no respite. And on top of that, they must deal with the ever-growing bureaucratic red tape systems from the Maryland Department of Health and DDA that do not work, policies that limit their choices and control over their own lives. They must simply passively endure if they want services. Or it may even be suggested to them that perhaps self-direction isn't the right choice for them, when for most of my customers, it is the only choice. Thank you for listening.
Our pleasure. Are there any questions for this panel? We have Delegate Kelly, followed by Delegate Kerr. Delegate.
Sorry, I had to unmute and I got distracted. I apologize. Thank you very much for this bill. My question is really simple. I was reading the opposition, and let me just note that I have constituents who are deeply concerned with this issue, so I know how important it is. But I was reading the letter from the Department of Health and really just wanted to ask your opinion on what seem to be their two main points of opposition. One is sort of that it would pose operational challenges, and the second is that evidently they believe that the federal money would be in jeopardy, that there's a rule from CMS that prohibits support brokers from having a fiduciary duty. So I know someone touched on this briefly when explaining the bill, but if you could tell me a little bit more about why you think that's not true, that would be helpful to me.
And only one person can answer from the panel, so your best person.
Okay, well, this is Carol Custer. I don't know if I'm the best, but I'll give this a shot. So there is nothing in this bill that will jeopardize the federal match. Everything that we're requesting has already been done in Maryland and approved under other waivers. So that we disagree with that completely. And CMS guidelines actually states that another term for a support broker could be a personal agent. Agents of individuals usually do have a fiduciary or do have to act in their best interest. We picked the term fiduciary duty in order to not call us the primary advocate anymore, because individuals are their own primary advocate, but the New Directions waiver started in 2005 used that term. So we were just trying to come up with a way that showed that your obligation as a support broker is to work for the best interest of the person. It does not conflict with any CMS guidelines. And I think by use of the term personal agent services, they've kind of make that clear. As far as oversight of support brokers, there really is no additional need. There's a team of people that can be fired at any time by the participant, and they do not make decisions. As a support broker, I can guarantee you I have never made a decision for a person. But they do need a professional who understands the system as best as possible these days and helps the families navigate this very user-unfriendly system. And I'm sorry, there was a third part to the question, and I'm not sure I addressed it.
Actually, that was a really good answer to my question. Thank you so much.
Okay.
Thank you, Delegate. Next, we have Delegate Kerr, followed by Delegate Bill Castro. Delegate Kerr.
Thank you, Madam Chairman. Delegate Lewis Young, let me follow up on Delegate Kelly's question with you, as I believe you're a member of the Joint Audit Committee. according to the concerns that the Maryland Department of Health has here, that portions of this bill would be contrary to the Office of Legislative Audit's recommendations, and then also what Kelly mentioned about the creating unreasonable operational challenges. Will you please address those for me?
Okay, I can speak to the audit comment because you're correct. I am on the audit committee. And in fact, when I read that comment, I went back through months of audit reports, which are extensive on DDA. I could not find anything. So what I did was I called and emailed Greg Hook, who is the chief auditor. And I said to him, what am I missing? I shared that comment. And I will share a very brief response that he sent to me. I had OLA staff who were involved with the last DDA fiscal compliance audit review HB 318 and the prior audit report, and they did not find any audit issue that we believe provides support for MDH's assertion that this bill is contrary to the recommendations of the Office of Legislative Audits. At this time, it's our opinion that MDH may have misunderstood prior report findings 3 or 4, and that could be the basis for MDH's statement. We are attempting to reach out to MDH officials to obtain clarification on their position, but might not be able to do it before the hearing. So I don't know if that happened. I'm not sure if I'm the best person to speak to the operational difficulties, but I will say, as I mentioned in my intro, there are basically 3 aspects to the program. The self-directed aspect was instituted in 2005. And the advisory council should not be significantly different from the quarterly SDAN meetings. SDAN stands for Self-Directed Advisory Network. You've heard many of the board members refer to that. They are supposed to meet quarterly, but my understanding is DDA has cut that back. So I think the advisory council would take the place of that, but perhaps through another question, one of the other advocates can correct me if I'm wrong. Thank you.
Thank you, Delegate, and thank you, Madam Chair.
My pleasure. Next, we have Delegate Bill Castro.
Thank you, Madam Vice Chair. Delegate Young, I'm going to reciprocate the question that you asked me in my hearing. I looked at the fiscal note and I was wondering if you had the opportunity to look at MDH's projections for the $3.3 million fiscal note.
I have, but Madam Chair, with your permission, I'd like to defer that to somebody else that has been working with the program for numerous years.
Go ahead. Who is that?
Okay, that's me again, Carol Custer. So we are actually very confused by that fiscal note, and we would ask for more clarification from MDH in order to adequately respond to it. But $3 million in programming cost is kind of confusing because they have to enter these people into the LTS system regardless of whether they're under this waiver or any new one. The advisory committee does not, or a bill does not require that a new waiver be created. It's just an option in order to get the characteristics of self-direction returned to Maryland. Since merging the self-directed and community pathways waiver into one back in 2013, DDA has created 2 additional waivers, the community supports waiver and the family supports waiver. So we're kind of confused if the costs were so high to create an additional waiver, why that was done. And we're also confused about why additional staffing would be required to administrate the program, because there is already a statewide self-directed coordinator and 4 regional directors, coordinators of this service. We do not believe any additional staffing should be necessary. And then regarding the amount of time of the staff created by the council, in last year's fiscal note on this same issue, the DDA stated, or the MDH stated, that the advisory council should not, let's try this again, stated that the advisory council could be staffed by would not need to be staffed by additional support. Sorry, I didn't type that correctly. There would be no needed additional support. So this aspect of the bill should not be changed. We also, as Delegate Young said, we meet with them on a regular basis. It was quarterly since 2018. And actually, they have increased the number of our meetings. And starting this month, they are going to be monthly. Before and during the COVID crisis, SDAN has met regularly with Secretary Neal about self-direction issues, along with the 7 other advocacy groups. The council would probably eliminate the need for many, if not all, of these meetings. Regarding their comments about the time and energy required to write or amend a waiver, because we are very heavily invested in this process, and we agree it is very time consuming. SDAN provided detailed comments each of the 6 times DDA has renewed, amended, or tried to amend the waiver since SDAN began in 2016. The current waiver renewed July 1, 2018, and Amendment 3 to that waiver was just approved by CMS this month. Unfortunately, very few of our recommendations rarely appear in any of the 6 waiver revisions that have come since we were in place. Again, sorry, I'm not the best public speaker.
That was fine. Thank you. Next, we have Delegate Hill, followed by Delegate Semple Hughes.
Thank you, Madam Chair. And I think this would a question for Ms. Custer again. I just want to clarify again, looking at the department's letter. As far as you are aware, since the self-directed program was originally done and carried out, as I understand it, ways that were very helpful to the clients, there have not been any changes in federal law that would prohibit Maryland from doing what they used to do. Is that
That's correct? The CMS guidelines were updated from in 2019, but nothing substantial changed in relation to self-direction.
Thank you, Delegate. Next, we have Delegate Semple Hughes, followed by Delegate Lewis.
Thank you, Madam Chair. Very quick question, but I just wanted to get clarity on how would the licensing requirements provide a risk? I don't know if Delegate Young would answer that or someone else on your panel. I know it was referenced, but I just needed to get just a little clarity.
I think that's me again. I think I'm the designated question answerer today.
You're doing a good job.
We'll see. We agree that providers need to be licensed. Our bill does not call for unlicensed individuals to provide services. The legislative analyst correctly understood our bill when stating in her analysis that MDH may not require a person that is authorized to provide services to a recipient in the state to obtain any additional approval to provide the same services to recipients who use self-direction. All we're saying is please do not put another roadblock in the way of getting services. If you're licensed to provide services in the state, you should not have to become DDA certified or licensed on top of that.
Okay, thank you.
Thank you. Next, we have Delegate Lewis.
Thank you, Madam Chair. Hope you guys can hear me. Yes, okay.
We can hear you.
Thanks, Madam Chair. Thank you, Delegate Lewis Young. My question is about the Advisory Council. How is it different from the oversight meetings that are already happening? What does it offer? What's the value add?
I guess I could take this one too. The value add is that it is going to require that DDA work with the council to establish a waiver that returns us to the principles of an independence plus waiver that the New Directions waiver that was in 2005 provided to the state of Maryland. And it also gives us the opportunity to report to the legislature about the issues that constituents and stakeholders are having with the Developmental Disabilities Administration on an annual basis. And it's in the hope that with your efforts, we can hold them accountable for the decisions that they're making on behalf of the citizens of Maryland that have actually been harmful to many of those citizens.
Thank
We're
you.
hoping it gives us some teeth, in other words.
I don't see any other questions. I do have one. When we met with you, the committee last year, the concerns that you raised, are they in this bill? Delegate Young?
One of them is,
Oh,
you want her to answer me?
well, if you can answer it, go ahead.
Delegate
You seem
Young,
to
you want
be
me to?
doing very well. Go ahead.
Okay. Okay, the only concern that's in this bill is related to making the fiscal management service a choice. That contract was to award fiscal management service to one provider. And the way it was written, it was pretty much geared to a large national provider, which would have eliminated the ability of the two Maryland companies that provide it now to remain giving service to providers. And it would have absolutely taken choice away. We feel that those providers from Maryland have done a phenomenal job holding this all together during the chaos that's been created in DDA in the last 5 to 6 years. And we just want to see that choice is maintained in Maryland for that very important service. Unfortunately, it seems like the DDA still intends to move forward with an RFP for hopefully not for one provider, but at least through an RFP process. It is not necessary that it be done that way. It could be a service, just like personal supports or community living or nursing services that's covered as a waiver service open to as many providers that are qualified to provide it.
Thank you, Ms. Custer, and you did beautifully today. There are no other questions. So thank you so much for your testimony. Now we're going into the unfavorable panel, and we have next Mr. Bernard Simmons.
There was about 41 individuals that participated in self-directed services. When I started here in 2014, there was 350 people enrolled in self-direction, and I committed to making sure that it was an available model, because all I had heard initially when I got here was if I can't find a provider or a provider won't provide supports to my loved ones, I am forced into self-direction. That is not a good plan at all for anyone. And so I did commit. I said we would do this. And as of last month, December, we enrolled 1,266 people. So that's an increase of 261%. So I'm not so sure that some of the comments that we've heard earlier today, and I don't mean this personal to the folks, but, you know, I hear things, we try to address them. It's not a perfect system. I understand that. That's why we meet with the SDN group, et cetera. But there's got to be something positive to it when we had a 261% increase. And I want to continue to enhance this model and move forward with it. Again, we've had our meetings, and then this, looking at this House bill, it includes some changes to the delivery model that are contradictory to the Center for Medicare and Medicaid Services in the technical assistance guide. And, you know, if we move forward with this, and the bill and says, you know, DDA, you should create another waiver, I'm not so sure some of the elements would even be approved by CMS. So as an example, in earlier testimony, there was some discussion about you can't do.
Sir, you have to start wrapping up, please. Your time
Okay,
is
so
up, please.
all right. So the bottom line is that we don't support this. Fiscal management services is an administrative function that needs to be conflict-free. It can't have any interference or any influence by people who are support brokers.
Thank you very much. Thank you.
Okay.
Thank you so much. Are there any questions for this panelist? One second, please. Seeing none, that concludes the bill hearing. Thank you so much for being with us today. We really appreciate your testimony. That concludes the bill hearing on House Bill 318.
Thank you.
Thank you.
Our pleasure. Next, we have House Bill 28. I have actually three bills